So one of the things that moms ask me a lot is, what things do I need to bring with me to the hospital? And I'll kind of go through a little bit of the list of the things that we're going to provide for you. So once you know what we're going to have for you here, then you know that you don't have to pack those and bring those with you. So for your baby, we are going to have sleepers, diapers. We'll have, if you're formula feeding, we will have all the formula and the bottles. If you're breastfeeding, we have a pump that you can use here and that we can supply you with, and those kit supplies can go home with you also. We'll have diaper wipes and everything. So basically all of the basic care for the baby and the clothing for the baby is all going to be provided while you're here. We use blankets initially when the babies are born, but then after a few hours we put them in a halo sleep swaddle, and we'll talk to you about those. Those are to encourage, it's to decrease SIDS for the newborns, and we're going to send one of those home with you that our auxiliary at the hospital here is generously provided for you, for every baby that's born here. As far as things for you as the mom, definitely bring some comfortable clothing. Sometimes moms don't really like the pads and things that we provide. So if you're one that's pretty particular about the kinds of pads that you wear when you have your period, you are welcome to bring those in. Just know that we will provide you with some. But if there's you're kind of particular with that, might not hurt to bring some of those with you. We'll also provide panties for you. Bring comfortable clothing. Other things to bring with you. Make sure you bring a charging cord for your phone. Funny enough, that's one of the things that people forget to bring in with them, and then also they leave them behind when they go. So remember to unplug it from the wall when you are getting discharged also. Other things, bring maybe some little snacks. Never hurts. Hard candy to suck on while you're in labor is kind of a good thing to have. Sometimes people like to chew gum while they're in labor. We will let you drink clear liquids, waters and juices, things like that while you're in labor, but not a lot of food. So those kind of things that you can chew on, suck on, help from your mouth getting so dry. Bring some lip balm too. We have some here also if you don't bring any, but lip balm helps keep you from feeling so dried out when you're in labor. So let's discuss what we have for pain medication options while you're here in labor. The first type of pain medication, we'll call it, is more comfort measures. So we've got a lot of things that we would encourage you to do. One of the things is to just be up and out of the bed and to try to move around as much as possible. We find that just laying in the bed lets you do nothing but concentrate on those contractions that are coming every couple of minutes. So if we can be up, just even walking around a little bit, those kind of things, that will help your labor to progress and also keep you more comfortable. We also have a large labor ball that you can sit on beside the bed. Some women just find that just sitting on there takes the pressure off of their back when they're having all those contractions. A second option that you would have for pain medication is to have a medication that actually goes right into an IV into your arm. That's typically a narcotic type pain medication, so we have to be careful of timing. We can't wait and give that medication too close when it's time for you to deliver because the baby may come out and be a little bit, we'll say, kind of stunned. Maybe just a little bit not wanting to breathe as well as what we would like it to be. So in order for us to prevent that from happening, we're going to have to time and watch how your labor is progressing. The other option that you would have for pain medication would be either an epidural or intrathecal. The epidural is definitely the most common pain medication that we use for our labor patients. That can be given at any point in time during the labor. It's kind of up to the doctor's discretion and what you're telling us as far as pain and when you're ready for pain medication. The epidurals are administered by our CRNA. They come in and it typically takes them about 15 minutes or so to come and administer that medication for you. The process itself to administer the medication takes about another 15 to 20 minutes. So when you're wanting an epidural, we kind of want to know before pain is really, really bad, because it does take a little bit of time for us to get that medication to you. When we are administering the epidural, we do a lot of monitoring of your blood pressure, of your heart rate, your oxygen level, and your baby's heart rate also. One of the other important pieces of information for you to be aware of is about C-section coverage. When you come into labor at Kossuth Regional Health Center, we always have surgery staff and anesthesia staff that are available in case the need arises for us to have to do a C-section delivery rather than the vaginal delivery that you may have planned on. So we also, in addition to the surgery and anesthesia staff, have staff members, our providers, who are available to do that. We have both family practice providers and a general surgeon who are able to do that surgery for you should the need come. I want to talk a little bit more specifically about this fetal monitor cart here. So we've got a couple of screens up here on the top. One of these screens when you're here in labor is going to show a tracing of the baby's heartbeat and your contractions. It's also going to display some information like your blood pressure, your oxygen level, those sorts of things that we're monitoring continuously while you're here in labor. Another screen is going to be your electronic medical record. So that's where we're going to be doing all of our documentation on. We've got keyboards that pulls out here and the mouse, and so you'll see us doing a lot of documentation during that. As far as the fetal monitor goes, there are a couple of different options for ways that we can fetal monitor your baby. One of them is probably the most common. It's a couple of straps. One watches the baby's heartbeat, one watches the uterine contractions. So this is the most common method of us monitoring your baby. We also have another fetal monitor. It's called a Monica. And the Monica is basically a patch that goes on the tummy, and it runs off Bluetooth signals. So we've got another unit that sits here on the table, and it feeds Bluetooth signals, and it talks to this unit, and that unit then talks to our basic fetal monitor here, which then gives us a tracing up here. That one, it's kind of temperamental, but we will definitely try to use that for you if we can. It allows you to be able to get up and walk around in the hallways and not feel like you're so tied down to that bed, especially before you're receiving pain medications. So education after you have a baby is one of the priorities for us after that baby's delivered and we know that you and your child are doing well. We want to make sure that we're giving you the amount of education that you need, what you need, and when you need it. So especially for first-time moms, that's a lot of information to cover. And like we said, if you're a vaginal delivery, you'll stay about 2 days at the longest. If you're a C-section, usually about 3 days. So it's a pretty short period of time that we really need to cram a lot of information into. We're going to cover information regarding breastfeeding. So if you're a mom that wants to breastfeed, we're going to start breastfeeding education within that first half an hour after that baby's born. We're going to encourage you to do skin to skin with the baby. We'll teach you on what cues to look for when your baby's hungry and when he or she is full and all those sorts of things of what you need to look for. Along with that, for breastfeeding, we do have one lactation consultant that is a nurse on our nursing staff here on 3rd floor. And she is more than happy to come in and help you anytime that she is here. There's also a couple of lactation consultants that are available from home health. And if you're looking for some extra assistance, we can help you get a hold of them and set up an appointment and get you in contact with them afterwards also. Along with the breastfeeding education, there's education on every topic in the world that you could probably come up with about a baby. And what I want to make sure that moms know and dads know is that there is no question that's a dumb question after you've had a baby. We will answer whatever you have, and we would much rather answer a question, even if you feel stupid asking it. We would much rather answer that question while you're here than for you to go home and sit and worry and wonder. So we're going to talk about things about how to bathe your baby, how to change the baby's diaper, how to give your baby a bath, how to know when your baby's sick, how to check your baby's temperature, all kinds of different things. But it's not only about taking care of your baby, you have to take care of yourself also. So we're going to make sure moms know how to take care of themselves, including what to do when those roller coasters of emotions happen after you have a baby. This is where the baby is going to be placed at for those first few minutes right after it's born. And this is an area that we can just be able to watch the baby, make sure their heart rate is good, their respirations are good, their color, that they're pinking up nice the way they're supposed to after delivery. This machine also allows us to do several other things. We have APGAR timers on here. We can monitor the baby's temperatures, where we can give oxygen. There's connections that we can breathe for the baby if we have a baby that comes out not breathing the way it's supposed to be. There's suction. We also have this monitor over here that was generously donated by the Hospital Foundation. And this is a monitor that can monitor the baby's blood pressure, their heart rate, their oxygen levels, respiratory rate, all of which are very important during that initial resuscitation period. So now I'm going to show you our nursery here. The first thing for everybody to know is that our nursery is locked at all times. In order for anyone to come into the nursery, they have to have a Kossuth Regional Health Center badge and be able to scan in and out. And we can keep track of exactly who comes in and out of this nursery. So everyone can feel safe in knowing that if their baby's in the nursery, that no one can come and take them from this place. In the nursery here, we have a crash cart with some supplies in case we would need it for an emergency with a baby. These are just general warming lights if a baby's having trouble holding their temperature on their own or needing some further assessments. We can put them under the warm lights to keep them stable. This just is another machine to assess their vital signs. Again, the computers for documentation. On this side of the room, we just have the baby's scale. We do hearing tests on every baby that's born at Kossuth Regional Health Center, and that is what this is. This is our hearing machine. Those are all done at 24 hours of age or after. We also bring the babies in here if it's a boy and they're requesting a circumcision. That's where we do that, is in here. The babies can be in and out of the nursery or with the mom as much as the mom and the parents are requesting. So if you're a mom who would like to keep her baby with her at all times, that is absolutely fine. If you're a mom that says, you know, I just want to make sure I get a few hours of sleep before I go home tomorrow, if we can oblige that and things are not absolutely ridiculously crazy on our floor, we will absolutely be happy to hold your baby and snuggle them here in the nursery for you. So along with all of the education and other things that we're doing here with you after you have your baby, there's a whole list of things that we have to have accomplished. We'll just call them tasks that we have to have accomplished before you're able to be discharged home from the hospital. First thing, of course, is you have to have your baby's birth certificate filled out. That has to be done before you go home. We are going to do a hearing screening on every baby. So in order to do that, the baby has to be at least 24 hours old, and we put some little earmuffs and a bunch of little electrode tags on it and push some bunch of buttons. It takes about 15 to 30 minutes to do a hearing test on a new baby. We also do a metabolic screening test. What that is a test that's mandated to be done on every baby that's born in the state of Iowa. That test also has to be done once the baby has reached 24 hours of age, and it tests for a lot of genetic diseases that we wouldn't normally pick up on by just looking at your baby. So things that your baby might look just perfectly fine, but these very rare things that can occasionally happen that blood work will help pick up. The other thing is we check every baby's bilirubin level. The bilirubin level is also jaundice. If you've heard of the term jaundice, it's what causes the orange coloration of some baby's skin. So we're going to check every baby's jaundice level or bilirubin level before they go home. Every baby is offered or administered a hepatitis B vaccine. We typically do that right at the time of birth. If we have a boy, they're offered to have a circumcision while they're here. Car seat inspection. What that involves is basically you bring in your car seat and we want to make sure that you know how to run it. We're going to show you the basics. We want to make sure that you know how to position the belts on the baby's car seat, and we want to make sure that you know how to get the car seat into the car nice and securely. Well, I would highly encourage you to talk to someone in home health even before you come into the hospital. They have actual car seat technicians that can go through, look at your car seat, that brand new baby's car seat that you just bought, and they can make sure that it fits into your car correctly before you ever even come in here to the hospital. So that's another option for you. We're also going to go over a demo bath with you. We'll make sure that you know how to give your brand new baby a bath. There's going to be some videos for you to watch. We have you watch some videos on care of your baby, also on infant CPR. That's an important thing for everyone to have reviewed before they go home. We will also offer some breastfeeding or home care referrals if you would like that, and also instructions just like we talked about for you, and instructions for your baby when you go home. So that's all the information that I have for you for our hospital tour today for the OB department. If there's anything that you still have questions on after watching our video, please feel free to get a hold of someone at Kossuth Regional Health Center and they'll be happy to answer any of your questions.